So in this video, I'm going to talk about a disease which is almost 100% fatal. Means if you get it, 99% chance that you will die. Yes, that is called rabies. But just think about it that you are a traveler, you are kind of walking around in a street somewhere in Thailand, and out of nowhere a dog comes running at you and bites you. Or maybe you are somewhere at a monkey temple in Bali or a place in India where there are a lot of monkeys, and they're very playful, but sometimes they can get angry and they can bite you. So what to do in this kind of scenario? Okay, because if you don't take immediate action and if you get the rabies, you're going to die 99.9% chances. Okay, so let's figure out how you can stay safe as far as the rabies is concerned. Hi everyone, this is Dr. Rakesh Shah from Life of Travel, and welcome to this episode number 3 of the series Medical Tips for Travelers, and we'll be talking about rabies in this particular video from the perspective of travelers. Now what qualifies me to talk about is 3 things. Number 1 is I'm a board certified doctor in the US practicing emergency medicine for a long time. Number 2, me and my wife have been to 66 countries, all 7 continents around the globe, right? So we have extensive travel experience. And number 3 is I was bitten by a dog in the past and I have received rabies vaccine myself. So I know exactly what I'm talking about in this video. So stick around until end. You are going to get some great practical medical advice. But at the same time, this is not an official medical advice. It's a legal disclaimer. I'm not your doctor. So if you encounter any of this situation, please talk to your own doctor or go to the nearest emergency room to get proper treatment. So let's go and understand this rabies from traveler's perspective. So as a traveler, you want to know, well, which animals can transmit the rabies. Obviously, you know about the dog, but then the cat, the bat, the jackals, the mongoose, the fox, the coyote, the skunks, the monkey, sometimes the cow or the goat. Cow and goat don't directly transmit that way, but they get it from the dog and then they transmit to humans. So for theoretical purpose, any animal that is called mammal, means the one with the breast, can transmit the virus, but the animals I just told you are the most common animals that will transmit the rabies. So as a traveler, you want to know which countries you have to be careful about rabies. Well, you have to be careful in every country, doesn't matter, but specifically you have to be careful in Asia and African continents. Specifically, if you are talking about Asia, then you have to be very careful in India, because almost 1/3, I think 20,000 deaths out of 60,000 worldwide happens in India, and that is where I got bit long time ago. But yes, so when you go to India, be careful. Then most of the surrounding nations, Pakistan, Nepal, Myanmar, Vietnam, Indonesia, those places you have to be very careful. And then when you come down to Africa, Kenya, Nigeria, DRC, South Sudan, Ethiopia, you have to be careful in the whole region because rabies is still there. But when you come to Western Hemisphere, the only country you have to be very careful is Haiti. That is where the rabies is very common, especially after the earthquake. Rest of the countries in Western Hemisphere, including Europe, you don't have to worry much. Australia, you don't have to worry much. But obviously the percentage is never a 0, you can still get it, but chances are very low for rabies. So these are the kind of countries that you have to be careful about. So briefly about how the rabies virus spreads in the body. So rabies virus stays in the saliva of the animal. So when they bite you, it breaks down the skin, and from there it goes in the muscle, stays there, and then it enters your nerve. It's a neurotropic virus, so it likes the nerves and the brain tissue. So it travels the nerve maybe 50 to 100 millimeter every day, and eventually it reaches, we call it dorsal horn, meaning thereby your spinal cord, and from there it spreads out in the nervous system, and it can actually come back in patient's saliva, and the patient's saliva can be infected to somebody else if that person for whatever reason bites somebody else. So this is exactly how the whole virus circulates. Now, what are the symptoms and how does a patient die? So the first phase we call is a prodromal phase. So it is just like any virus infection, even like just a flu virus. You get the virus, you get the body ache, fatigue, nausea, vomiting, not feeling well. Those kind of the common symptoms. So sometimes you actually miss the whole thing. You don't even remember because it takes 1 to 3 months for the symptoms to even start sometimes. So you can't even remember that you were beat by something and now you got the symptoms. So you can't connect the dot, but that is how it happens. And then after a few days of those prodromal symptoms, the virus starts going to your brain, and that is when the real tragedy starts. And things that you can divide the presentation in two things. One is we call is a furious rabies, typically in the dog, like we call dog got mad, furious rabies, and dumb rabies, that is a paralytic rabies. So in the humans, it can happen encephalitic, which is furious, it goes in the brain, or it can be paralytic where you can't move at all. So what happens that the two classical thing, one is hydrophobia, where the fear of the water, the even thought of the water causes the spasm in the esophagus, it goes in the spasm. So basically if you visualize rabies, everything is running faster and doing more than it should, and everything is tight like that. Okay, so you get muscle spasm, you get seizures, your esophagus, your pharynx goes in the spasm, you can't eat, you can't breathe. And then there is a thing called aerophobia, just the thought of air, even air moving around your face or touching you, it causes the spasm. Very terrible way to die because you're still kind of awake, but eventually you go in the coma and then you die. Then you die because of asphyxia, because you can't breathe, you can get pneumonia and all kinds of complications. So it's a horrible way to die. And some people, 20% of the people, they get the paralytic rabies, where everything is paralyzed. Basically they can't move anything. The paralysis can be symmetrical, asymmetrical. So it's a very tragic situation to see any patients with rabies, but these are the things that can happen once you get the rabies. So make sure you get the vaccines, which I'm going to talk in just a second. So now we have come to the part that you've been waiting. Okay, but before we get there, can I request you to hit that like and subscribe button so that you can get more of such informative videos full of lot of practical tips for travelers. So vaccines divided into two parts: pre-exposure, post-exposure. Who needs pre-exposure? People who are high risk to get the rabies. Who are those people? For example, animal doctor or researchers, or any activities like some people do cave exploration. So those people are at higher risk of getting rabies. Or if you're going to be in a place where the medical care is not going to be optimum, or the chances of those hospitals stocking on the rabies vaccine is pretty low, so that's the place where you really need to get the pre-exposure prophylaxis before you go there. The pre-exposure prophylaxis is a vaccine that you take two doses, day 0 and day 7. And it is two types of vaccine: human diploid cell vaccine, that is HDCV, and then chick embryo vaccine. So you take those two doses, and some people who are considered as a high risk, they may need a booster dose after a year or two whenever they are going to be engaged in the same activities. But before that, they need to check their blood, make sure that rabies antibody titers are lower than normal. Then they need a booster dose. Otherwise, most people don't need booster dose. So that's about the pre-exposure prophylaxis, and in the next section I'm going to talk about the post-exposure prophylaxis. Now I'm going to talk about what to do after the exposure. Right away you should clean the wound with soap and water for at least 15 minutes, and then put some betadine, iodine on the wound to kill whatever virus you can kill, and then go to the nearest emergency room to get further treatment, which includes tetanus vaccination, because that's another disease you don't want to die of. It's a horrible way to die too. And antibiotic for any bacterial infection. But after that, the most important thing you need to get is the vaccine and the immunoglobulin if you have not received the pre-exposure prophylaxis. And if you did receive the pre-exposure vaccines, then you only need vaccine, not the immunoglobulin. I'll tell you the difference. Like if you did not receive the pre-exposure vaccine, that means your body has not formed the antibodies. So you need antibodies right away, and you need vaccine to protect you for years to come. You have to divide the immunoglobulin in two parts. One goes right at the site of the wound and the other goes in the muscle. Okay, and sometimes putting in the wound itself can be very painful if it's like a fingertip or something like that, but do whatever best you can to put as much as possible in the wound, and remaining goes in the muscle, that is intramuscular. And then you get the post exposure vaccine for the people who are not immunized before the exposure, and for them it's a 4 doses, 0, 3, 7, 14. So obviously today whenever you get it is called day 0, and then when you come back your home you can get day 3 or 7 and 14, or wherever you are, that is the same vaccine. It takes total 4 doses. And if you already got the vaccine before the exposure, then you only need 2 doses, that is day 0 and day 3. So that's in nutshell about the post exposure prophylaxis for rabies. So thanks for watching this video till end, and I'm sure you got a lot of nuggets from this video. And if you have not already done so, can I request you one more time to hit the like and subscribe button. And if you feel even more generous, you can write your comment and share if any experience you have had in different countries. And if you can share the video with other travelers, they will really benefit out of it. So I'll see you in the next video. Okay, thank you so much.